Sure. So my financial disclosures are none. I'm just presenting PDR vitrectomies are very challenging and require different approach from case to case, and it's still challenging for all the retina surgeon, and they have their different way of managing it. So I'll show you one video where here it's kind of an tabletop kind of attachments, and it's very tough. We always try to prevent the iatrogenic break in such situations. So I put the chandelier illumination, and with the bimanual technique, we started dissecting, but still there was a break. With help of the scissors, we have separated the membrane, and it helps very well in the desegmentation laminations. At the end, the break was laser, and because there was a iatrogenic break, silicone oil was injected. Now, there is another way. We have a bevel 25 gauge cutter, which can be used in such situation. But first, we use a bimanual technique to dissect the membranes. Once membrane is removed, we have stained with the brilliant blue dye, done ILM peeling. Still we see some of the subretinal bands. So we have done a retinotomy, and directly with the help of cutter, we have used a vacuum to grasp the subretinal, which can be used alone with the help of 25 gauge cutter itself. One more way, the 25 gauge cutter itself, bevel cutter useful where exactly this is a retinal folds and the membranes and the diabetic vitrectomy. With the help of a cutter itself alone, we can go in between the bridging tissue and it just pass on the retinal surface as a spatula. And and the retinal folds are separated with help of cutter only. So, and at the end, so all the tissues were removed with the help of only cutter vitrectomy, and fluid gas exchange was done. So this advanced ultraviolet vivid high-speed cutter added the versatility, and it gave more access to the tissue plane, and it reduced the dependency on scissors and forceps, and it provides the increased efficiency by improving duty cycle and more flow, which is faster the vitreous removal compared to the older cutter. Now, compared to this data, 25, 23, and 27 gauge, in 23, it can go very close to the surface compared to 25 and 27. So the 10K bevel cutter are more helpful in 25 and 23 gauge, which has tip to port retina proximities, more closure. So take-home message for the diabetic vitrectomy is we can maximum use of cutter for dissecting membrane can be used. Identifying the proper plane of dissection is most important. Avoiding iatrogenic breaks. A meticulous removal of all the membrane is a must, and use of proportional reflux hydrodissection or viscodissection can be very useful. Sure. Thank you very much. Thank you, Doctor.